Have you ever wondered if herbal remedies could provide relief for mental health conditions like schizophrenia and depression? It's a question that's been catching the wind recently, and for good reason. With the world becoming more conscious about what we put into our bodies, it's only natural that we question the status quo of mental health treatment. Now, before we dive into the heart of the matter, let's take a moment to understand what we're dealing with. Schizophrenia and depression are two mental health conditions that, while distinct in their characteristics, share a common thread. They can significantly impact a person's quality of life. Schizophrenia is a long-term mental disorder involving a breakdown in the relation between thought, emotion, and behavior. Depression, on the other hand, is a mood disorder that causes persistent feelings of sadness and loss of interest. Both conditions are typically treated with a combination of medication and therapy. But what if there was another way? An alternative path that veers away from the traditional route of pharmaceuticals? That's where herbal medicine comes into play. Herbal medicine, or phytotherapy, is a healing practice based on the use of plants and plant extracts. It's been around for centuries, used by our ancestors long before the advent of modern medicine. A growing body of evidence suggests that certain herbs may offer potential benefits for people living with mental health disorders like schizophrenia and depression. The world of herbal medicine is vast and varied, with remedies hailing from every corner of the globe. From the calming chamomile flowers of Europe to the mystical ashwagandha roots of India, these natural powerhouses are more than just pretty plants. They are nature's gift, offering a ray of hope for those seeking alternative ways to manage their mental health. But like any form of treatment, it's not without its fair share of questions and concerns. How effective are these remedies? Are they safe? Do they have side effects? And most importantly, can they truly replace or supplement conventional treatment options? So the question arises, can herbal remedies be a viable alternative for schizophrenia and depression treatment? Schizophrenia, a severe mental disorder, often requires complex treatment. But could herbs provide a solution? Let's deep dive into this. The world of herbal remedies offers a variety of options that some believe may help manage the symptoms of schizophrenia. Two of the most commonly used herbs are ginkgo biloba and Asian ginseng. Ginkgo biloba, a tree native to China, has been used in traditional medicine for thousands of years. While it's primarily known for its potential to enhance memory and cognitive function, some studies suggest that it might also be beneficial for schizophrenia. You see, ginkgo biloba contains powerful antioxidants that can protect the brain against damage from harmful molecules. This could theoretically help manage some of the cognitive symptoms associated with schizophrenia, such as trouble with thinking and concentration. Asian ginseng, on the other hand, is a root that's been used in Asian medicine for centuries. It's been praised for its potential to boost energy, lower blood sugar, and promote relaxation. In the context of schizophrenia, Asian ginseng might help by reducing stress and improving mental function. Some research has shown that it may even have antipsychotic properties, which could help manage hallucinations or delusions. However, let's be clear, while these herbs might show promise, the research on their effectiveness for schizophrenia is still ongoing, and the results so far are not definitive. Furthermore, it's important to remember that these herbs should not be used in place of prescribed medication or therapy. They might help manage symptoms, but they are not a cure. It's also worth noting that everybody is different, and what works for one person might not work for another. If you're considering herbal remedies for schizophrenia, it's crucial to discuss it with a healthcare provider first. They can provide guidance based on your specific situation and ensure that any herbal supplements won't interfere with your current treatment. Herbs might not replace traditional treatment, but they could offer additional support. And who knows, as research progresses, we may discover more about the potential benefits these natural remedies could bring to the table. Depression affects millions globally. Herbal remedies like St. John's wort have been touted as potential aids, but do they really work? Let's delve into this intriguing topic. One of the most frequently mentioned natural remedies for depression is a flowering plant called St. John's wort. This herb has been used for centuries in traditional medicine as a mood enhancer. It contains a compound called hypericin, believed to have antidepressant effects by influencing certain brain chemicals like serotonin. which is responsible for maintaining mood balance. However, it's important to note that while studies have shown some promise, the results have been inconsistent, and more research is needed to determine its full effectiveness and safety. Another herb often recommended for depression is chamomile. This daisy-like plant is usually consumed as tea and is known for its calming properties. It contains an antioxidant called apigenin, which binds to specific receptors in your brain that may decrease anxiety and initiate sleep. Some small-scale studies have suggested that chamomile may help with depression symptoms, but again, more research is needed to confirm these findings. Ginseng is another herb that's been used for thousands of years in traditional medicine. It's believed to enhance mental clarity and reduce fatigue, two common symptoms of depression. However, while some scientific studies have shown it may have a positive impact on mood, others have found no such effect. It's crucial to remember that while these herbs may offer some relief from depression symptoms, they are not a replacement for conventional treatments. The complexities of depression mean that what works for one person may not work for another, and it's important to find a treatment plan that's tailored to your specific needs. Furthermore, these herbs can interact with other medications and have side effects, so it's essential to consult with a healthcare provider before starting any new treatment. They can guide you on the right path, ensuring that your approach to managing depression is both safe and effective. While these herbs may provide some relief, it's essential to consult with a healthcare provider before starting any new treatment. It's easy to dismiss herbal remedies as just plants, but there's a complex science at work. Let's dive in. Our bodies are intricate systems, and the brain, the command center, is no exception. It's a network of billions of neurons that communicate using chemicals called neurotransmitters. These neurotransmitters are responsible for regulating everything from our mood to our ability to learn. Now let's bring herbs into the equation. Many herbs contain bioactive compounds. These are chemical substances that have an effect on biological organisms like us. The bioactive compounds in herbs can interact with our bodies and brains in various ways, including influencing the production, release, or function of neurotransmitters. Take St. John's wort, for example, a common herbal remedy for depression. It contains a bioactive compound called hyperforin, which is believed to increase the levels of certain neurotransmitters, including serotonin, often referred to as the feel-good hormone. By elevating serotonin levels, St. John's wort may help improve mood and reduce symptoms of depression. But it's not as simple as it sounds. The brain is incredibly complex, and we are still learning about how it works. This complexity makes it challenging to research and understand the precise effects of herbal remedies. Additionally, the bioactive compounds in herbs can vary significantly in concentration and effect, depending on factors like where the plant is grown and how it's processed. So, while we have some understanding of how certain herbs may impact our brain and body, there's still a lot we don't know. This is one of the reasons why herbal medicine isn't a one-size-fits-all solution, and why it's essential to consult with healthcare professionals before starting any herbal regimen. Moreover, research into herbal medicine's potential is ongoing. With advancements in technology and a growing interest in natural alternatives, the future of herbal medicine is promising. Understanding the science behind herbal medication allows us to appreciate its potential while recognizing its limitations. It's been quite a journey exploring the potential of herbal remedies for schizophrenia and depression. We've delved deep into the world of alternative treatments, shedding light on the role these remedies play in managing mental health conditions. From St. John's wort to ginkgo biloba, we have seen the vast array of plant-based treatments that have been used throughout history to combat these challenging disorders. We've also discovered the importance of understanding the science behind these remedies, recognizing that while they are natural, they can carry potential risks and side effects. It's essential to remember that just because a treatment is herbal or natural doesn't necessarily mean it's safe or effective for everyone. Each individual's biochemical makeup is unique, and what works for one may not work for another. This brings us to one of our most crucial points: the importance of consulting with healthcare professionals before starting any herbal treatment. It's vital to discuss your plans with your doctor, psychiatrist, or a trained herbalist who understands the complexities of mental health disorders. They can guide you considering your specific symptoms, medical history, and any potential interactions with other medications you're taking. We encourage you to keep an open mind about alternative treatments. There's a growing body of research supporting the use of certain herbs in managing mental health conditions. However, it's equally important to recognize the value of evidence-based medicine. Herbal remedies can complement conventional treatments but should not replace them without professional guidance. In conclusion, the world of herbal remedies offers intriguing possibilities for those living with schizophrenia and depression. However, it's crucial to approach it with caution, armed with knowledge and guided by professionals. Herbal remedies may offer hope, but remember, they are a part of a larger treatment plan. Stay informed, stay safe, and always prioritize your mental health.